Idowu beats.
Good morning. I'm Dr. Seyi Idowu. I'm an orthopedic oncological surgeon at the National Orthopedic Hospital, Igbobi. What that means is that I'm an orthopedic surgeon with special interest in bone and soft tissue cancers. Cancer basically means abnormal growth in any of the tissues or organs of the body. So normally, they are regulators for growth of any tissue in the body. It's been put there by nature and is meant to stop at a certain need level and then correct itself. But sometimes cells, for some reasons, may begin to function abnormally or grow abnormally to the detriment of the surrounding tissues. And what you have is that it then affects the body's function generally because they increase more demand on the energy that is available in the body. They can also cause more damage to other structures around where they are growing. Symptoms for cancers includes lumps, swellings, loss of weight, loss of appetite. Generally, sometimes you notice, depending on where the cancer is, if you have cancers of the prostate, you begin to see that you are developing difficulty with passing urine. You're passing urine either frequently or you are just not going as you used to be. When you have cancers in the bowels, you begin to see either blood in your stool or you find out that you are constipated, and that means that your bowel habit changes. For women, it is usually lumps in the breast, which every woman of matured age should actually be able to, feel for and look out for usually. So I'm one of the members of MONSOF, which is the Musculoskeletal Oncology Support Foundation, which basically focuses on raising awareness and raising funds for research and treatment of musculoskeletal cancers, which is bone and soft tissue tumors. We had an awareness program late last year, about October, at the stadium in conjunction with another organization, which is called Neola Cancer Foundation. What we tried to do with that was to use dance to raise awareness about various types of cancers. And we're also continuing with regular educational programs, awareness, poster presentation, and things like that. As a practitioner, probably started practicing about 25 years ago. Yeah, but being in orthopedic oncology practice in the last 10 years, I would say. So one of the things, I'll tell you what we've been able to do here in this hospital is to have what is a multidisciplinary team. So cancer is not something that you get one doctor to manage once you've been given that diagnosis. Because of its peculiar nature, you have to have more than 2, 3, 4 doctors looking after various aspects of things. And we've been able to develop that multidisciplinary group in this center. They're rolling for about 10 years or thereabout now. We have regular meetings. We discuss difficult planned patient treatment and things like that. The other thing is the MONSOF that I mentioned, which is an NGO. And basically what that does is, one, it raises awareness. So we do that by public education programs, posters. We also have regular meetings with people to sort of tell them more about cancers. We've also been able to raise funds. I think in the last 2 years, the organization must have raised up to 3 to 5 million to help patients who are indigent, who couldn't afford treatment at all for various bone and soft tissue tumors. We're also committed to research. So a few of us who are clinicians are trying to develop newer ways to bring the burden of the disease down and make sure that there's early diagnosis, because the key to managing cancer is early diagnosis. A lot of people die because cancers were discovered too late. Okay, so what happens? Common cancers like breast cancer, which is one of the most common cancers in all over the world and even in Nigeria, or prostate cancer, which is the one that is more common in men. When they develop in those organs, they have a propensity, that is, they have this tendency to spread into the bones. And there are scientific reasons for that. And what they do is destroy the bone. At that stage, you're already saying that that patient has an advanced disease which has involved other systems in the body. From destroying the bone, you get a fracture, which we call pathologic fracture. And of course, if you have a fracture anywhere in the body, it's going to be very painful. You cannot move. You can't use that body. So the functionality of that particular part of the body is impaired. And that's where we need to repair that or reconstruct, as it were, as well as treating the cancer at its origin. Well, if you're looking at bone cancer, so we can talk, bone cancers can be primary, which is arising primary from the bone, or they can be secondary, which is what I described earlier, when you have them spreading from other parts of the body like prostate and breast. For the primary cancers of the bone, the most important thing that I tell people is lumps and bumps. If you feel any lump on any of your limb that is not there before, it's better to shout immediately, get somebody competent, like a doctor, to examine you thoroughly and decide whether you need investigations such as X-ray or MRI scan to say this is benign or this is something that we need to worry about. So most importantly, lumps and bumps for the primary cancers. For the secondary ones, it's bone pain. If you get bone pain that is unusual in any part of the body, I think you need to tell people quickly. You tend to present more with bone pain before lumps and bumps, so it's also something to worry about and quickly get checked out. Not really. There's really no, I'm not aware of that in the literature, a direct link of rheumatoid arthritis. That's what you're trying to describe, or osteoarthritis. And generally, people describe arthritis as rheumatism, but arthritis can take various forms. It can be the one that you're talking about, which is rheumatic arthritis, but the more common one is the osteoarthritis, which is the wear and tear with old age, like you're saying. That will happen to a lot of us, or most of us, depending on the time or how long we live to. It's just like when you buy a car. If you drive it for 10 years, you need to do something to the wheels and the bearings and things like that. So it's just wear and tear. There's no direct link with that and cancer. Okay, fine. I'll start with the last one. Environmental pollution. We don't really know how much damage that does to cause cancer generally, but there have been a lot of studies supporting the fact that when you have areas that you have pollutions, chemicals especially, and there have been local studies here in Nigeria, especially in the Niger Delta area, people are more predisposed to certain form of cancers because you are exposed to those chemicals in water, in the soil and things like that. And that, I think, is for a fact. The other thing you mentioned is tobacco. Tobacco is dangerous. That's why you see there's a lot of public health pressure to get people to quit smoking. But what smoking does is been associated with almost every cancer that you describe in the body, because it causes changes in the cells that allow those cancer tissues to develop quicker. Alcohol, because is also associated with a lot of cancers, particularly the liver cancers, the cancers of the stomach. So if you are taking alcohol excessively, then you are likely to develop those cancers, and that is a strong risk factor. Well, first is cancer is not a death sentence. I am young in practice, and I have people who are older than me who have patients who have lived 20, 30 years, after their diagnosis of cancer. It is not a death sentence. Let me just emphasize that again. What makes cancer a death sentence, or the perceived notion, is because in our environment, many patients present too late to be saved. And cancer has like 4 stages broadly. So if you have picked somebody at the stage 1 or 2, which are the early stages, there are a lot of treatments, aggressive treatment now that is available even locally in many of our hospitals that can get rid of the cancer. People can live as long as God permits. We usually say we measure those survivors in 5 years. So the 5-year survival of some cancers now at stage 1 or 2 is approaching 100%, which is remarkable. And if someone lives for 5 years after a disease, then you can't really say that's the cause of the disease. But the main problem is the late diagnosis. When you pick a lot of patients at stage 4, it's too difficult to save, to get the survival. I think we are diagnosing cancers better in the country. That's because whether you like it or not, there's been more awareness. I think there are lots of people doing a lot. NGOs, non-governmental organizations dedicated to cancer advocacy So they're trying to get people to know when to seek. So I think we're diagnosing more. As to whether we are having better survival, I'm not quite sure. I think we still have very poor data to support that. But I would, I'll say maybe yes. Maybe the educated folks or the aware folks would seek treatment earlier, and then you can get, I think certainly it's probably better than what we had 10 years ago. So the most common cancers locally in the country in men is prostate cancer, lung cancers. In women, then it becomes the breast cancers, okay, which is more common. But generally, people think, people believe from studies that breast cancers all over the world is one of the foremost cancers, and then you follow by cancers of the prostate, lung cancer, colorectal cancer, which is cancers of the bowel. And the key to treatment, like we said, is still diagnosis, early diagnosis. And there are a lot of screening methods that are available in various centers to just tell you how to spot them early. So the way to spot cancer and early diagnosis for breast, for instance, for women, they usually should know how to do self-breast examination, which is the SBE. So every woman should be able to examine herself. And that doesn't mean that breast cancers cannot occur in men. So even when a man suspects or feels a lump, you need to cry out as well. Yes, a certain percentage of breast cancers occur in men, and there are reasons for that. So that's one way to spot it for breast. For things like prostate cancer, there's a specific biomarker. It's a blood test that should be done by African men, above the age of 40. It should be done every year to monitor that level of the blood test. If that level is higher above, if it's higher than normal, then we worry, because then we begin to screen that patient or that individual further to find out whether it's prostate cancer or not, even when there's no symptoms. So those are the kind of things that can, bring about early. And for people who are above 60, 65, who are at risk for colorectal cancer, you should actually be aware of your bowel habit. Any change in your bowel habit, you go every day, you don't go again for 2 to 3 days, there's a reason to shout and speak to your doctor. And there's tests that the doctor can do, such as occult blood, check for blood that you're not even seeing in your stool sample, and that will raise a suspicion of something going on that will warrant more investigations, like a camera test, which is either the sigmoidoscopy or colonoscopy, as it were. So some men are predisposed to cancer if you have something like what they call a condition called gynecomastia. So some men are born with, a breast that is larger than normal. Some men also have hormonal imbalance, and the hormonal imbalance can predispose them to breast cancer. So it's something that can occur in men as well. We just need to be aware. Okay. But the majority of it obviously occurs in women. I think the biggest challenge to any healthcare or healthcare in developing world like Nigeria or countries is funding. So money. I'm sure if there's enough funding for the healthcare policies to be implemented properly, there will be a lot of changes in our structure. Nigeria doesn't really lack too much in terms of human resources. There's hardly any field where you won't find people who have gone to equip themselves and they are very competent in that area. But when people come back after training, there is no funding to equip them enough to do as much as they would love to do. Okay, and it also falls back to the patients. The patients themselves are not well supported. We don't have insurance. Health insurance is, the availability is very low, the coverage within the country. So when you have patients at the time that the patient has a lump that needs to be investigated and is expensive, and at that point you tell somebody to go and pay out of the pocket, where is he going to get the money from? Because he's already off work anyway. So it's quite a challenge. I think one of the most important things is funding. Then two is habit and culture. A lot of our people are still stuck in the past. People still believe in doing things the native traditional ways that are not proven. I'm not saying all our native or traditional methods are bad. No, there must be a lot of things good in what our fathers were doing, but you need to remember that every part of the world was like that too. But they've all now moved on to the refined methods that have been proven time and time again to be the way things work. So rather than come to the hospital or go to a doctor to get checked out because you have a breast lump, a lot of people resort to herbs that have not been proven, to work. And there's a joke I used to tell them. I said, America is a very lovely country. They look all over the world for brilliant minds. You think if these things were working, the herbs and all those things, you think the American president himself would not have come to visit you and take you back to Washington so that you can continue the magic there. So we need to define proven methods rather than just rely on our cultural, practices.